Good morning, all of you. My name is Chand Praveen Nandev. I am from Jalna. I recently passed out my Bachelor of Pharmacy in Dr. Babasaheb Ambedkar Technological University, Lonere Raigad. Today's subject is technical, and today's topic is introduction of medical coding. So we are start. Medical coding is the process of translating of the medical diagnosis, procedure, service, and equipment standardized codes. These code are used for the activity purpose of the including the billing and the insurance of the claim record keeping and medical research. The codes are derived from the clinical documentation provided by the healthcare provider during the patient visits, including notes on symptoms, diagnosis, and procedure of the treatments of plan. Medical coding is the essential for the ensuring the accurate billing, the reimbursements of and data and management of the healthcare system itself to streamline administrative tasks and supports the healthcare policy development and ensure that medicine claims and proceed correctly and efficiently. The key component of medical coding, first of all, is diagnosis code. These codes are represented in the patient medical condition or diagnosis. In this, in the United States, the International Classification Disease (ICD), the coding system is used. Current ICD-10 contain codes for worldwide, the range of disease and condition. Then diagnosis help of the explain why the patient are seeking medical care. Then procedure code, the codes are used to describe the procedure services provided to the patients. In the US, the current procedure technology CPT is the widely used this purpose. The CPT codes maintained by the American Medical Association AMA, the cover the outpatient and the physician services. The healthcare common procedure is coding system is another coding system is medical and Medicaid services, including some medical equipment supplies. Then modifiers codes are provided additionally information about the procedures of services, such as the change in the natures and services of the indicate data procedure was the performed in the different way from the standard. These help of ensure the more accurate bill billing and clarify any special circumstances. Other code ICD-10 PCS used the U patients procedure in the US. The National Drug Codes NDC, the identifying the drug biologics, the diagnosis and related group system to classify hospital case, medical billing purpose, etc. Then why medical coding is important? The billing and reimbursements. Accurate coding ensure that the healthcare provider receive appropriate reimbursement for the service, and they provide insurance companies really on. These codes are process claims that determine how much to pay services retarded. If codes are incorrect and improperly the linked with the healthcare provider may face claim denial and delayed payments, even and fraud association, etc. Healthcare data management. The medical codes provide the standardized way to patients' information. This helps to organize large amount of the clinical data, making assessing and enable medical research. The policy of the decision and health outcome monitoring. This data can used for analysis, disease trend, effectiveness of treatment, and healthcare cost management. Then regulatory compliance. The proper coding required by the healthcare regulation including those that set Medicaid, and private insurance. The companies ensure healthcare organization meet government standard and avoid penalties. Research and public health. The researchers on the coded conduct the study the diseases and treatment. The outcome of the healthcare is utilization. The contribute the development of the evidence based practices. The public health is the authorized use medical coding and data track analyze disease and outbreak healthcare utilization patterns and resource allocation. The process of medical coding, the clinical documentation, the coding process, the begin healthcare provider documentation, patient information and medication record, including symptoms and diagnosis and treatment. The medical coders really on this documentation assigning approved codes. Then code assignments. Code assignments is specialized manuals or software. They identify the correct code diagnosis procedure. They must understand context in the medical record to ensure the right code are assigned. The coders, the cross reference the documentation with the standard coding system like ICD, CPT, and SCP. Review and verification. After the codes assigned, they are reviewed, ensure the accuracy, and the completeness. The coder may need to consult with the healthcare provider. There is the ambiguity and documentation. The claim submission. The code that are prepare insurance claim billing, and they involve in submitting the claims of the insurance company or government. For example, Medicare for a requirement. Medical coding system. The first of all, ICD-10, International Classification of Disease, is 10th edition. Then second one is CPT, current procedural terminology. Then third one is HCPS, Healthcare Common Procedure Coding System. This is the medical coding systems. Then role of medical coder. Medical coder are professional who specialize the assignment and correct codes medical diagnosis and procedure and service. The primary responsibility include. Thank you for watching my video.